Lesson number 2 is dealing with cultural diversity. There are so many different patients that you're going to have to deal with, and family members, as well as other staff members. So cultural diversity is a huge issue within the NCLEX exam. One of the areas that we want to look at is the disparities of healthcare and health within different groups. It's well known and studied that there are disparities of health given someone's socioeconomic, ethnic, or racial groups. As a nurse, your job is to provide the best care to all possible patients, regardless of their cultural issues or concerns. Cultural competence. The United States is probably the most diverse population of any country. Therefore, you'll be treating a wide variety of patients from many different cultural backgrounds. You must be able to understand and empathize and provide treatment regardless of a patient's cultural concerns, issues, or habits. You must be able to understand and empathize with a patient's cultural issues, concerns, beliefs, habits, and then you must be able to provide a treatment regardless of those issues. You must educate yourself about a patient's cultural needs if you're not familiar with them. If there's a patient with a different background than you've ever been exposed to, you need to learn that for yourself so that you wouldn't do something that would jeopardize your relationship with the patient or your relationship with the family. A perfect example would be organ donation. There's many cultures in which organ donation is very taboo. So you would really want to know that before you went in and asked a family member of a patient who is dying or on life support if they would be willing to donate the organs. Let's go into some cultural competence. There's a young Hispanic doctor who wants the office staff to treat her patients better. She's dismayed when she overhears a staff member say, there should be a law that everyone should speak English in this country. What we want you to think about is how would you handle that situation? There are a lot of different speaking nationalities in the United States and in healthcare. Can we afford to have a translator go in and translate for every single patient who's getting health care? So sometimes this comes down to a use of resources. Another option might be to have a family member who's reliable do the translation. But we also have staff that we're tired. It takes a lot to concentrate and listen to somebody who doesn't speak our language or doesn't speak in the same way or communicate in the same way we do. So you really need to ask yourself, what are my biases about some of the cultural diversity that I'm going to have to work with? Did you know that the U.S. population is about 225 million people? That is the third largest populated country in the world. In addition, the white population is about 63%, and it decreases every single year. So the nationalities that are increasing are the Hispanic Latinos, the African Americans, the Asians, and a number of other groups. You need to keep in mind if there's groups that you're not familiar with, you really want to become more educated as to what some of those cultural beliefs are. So we would ask that you really focus on that as you become a nurse and work in the United States.